We ready? Bless you. Are we live? Thank you so much. My brothers and my sisters, I greet all of you and welcome you here to St. Joseph AME Church. I'm Dr. J. Augustine, the senior minister here, and it's a pleasure to have some here physically, but most joining us virtually. As I welcome you this morning, I want to take just a moment to share with you that I am the 31st senior pastor of this storied church, and I am very much aware of the proverbial shoulders upon which I stand. Meaning, this church, this congregation, has a rich history of being out front as an advocate for matters of social justice. Matters of social justice from this church have included civil disobedience in the form of a sit-in that began the civil rights movement here in Durham with the Royal Ice Cream 7. Matters of social justice for years and years have included protesting and marching to make sure people had the right to vote. Now, however, here in the 21st century, the preeminent matter of social justice that literally is one of life or death is making sure there is adequate access to the COVID-19 vaccine. The panel that you will hear from today, and we're delighted to co-convene with an advocate for social justice in the form of State Senator Natalie Murdock, but the panel you will hear from today is here to dispel any misinformation. They're here to provide accurate information and to ensure that everyone has access to the vaccine. We're delighted to be in partnership with you. We're delighted to share this day with you, and you are always welcome here at St. Joseph Church. I'm going to defer now to my friend, and I'm proud to say my senator, the co-host for today, Natalie Murdock.
Good morning, and thank all of you for joining us for COVID Talk 2. We first want to begin by thanking Reverend Dr. J. Augustine and the St. Joseph AME family for continuing to open their doors so that we can continue to have these critical conversations. As Reverend Augustine just mentioned, St. Joseph's has a rich history of serving as a community leader, being at the forefront of the most prevalent social justice issues that are prevalent in the African American community. It's no secret that COVID-19 vaccines are scarce. This scarcity will fuel our tenacity in seeking equity and access. This week, I heard a chilling statistic. Life expectancy for Black populations declined the most from 2019 by 2.7 years to 72 years old. This is the lowest it's been since 2001. Latinos experienced the second biggest decline, falling 1.9 years since 2019 to a life expectancy of 79.9 years, lower than when it was first recorded in 2006. This is why we must continue to have these critical conversations and engage the entire community so that we can move forward. This is a crisis that will already have a generational impact for years to come. It will take a widespread community-led effort to provide greater access and equity to those that are marginalized and communities of color. Today, we will talk with stakeholders at Duke Health, NCDHHS, and the Durham County Health Department to learn how we can GOTV get out the vaccine to those that need it the most. With that, we will begin our panel. All right, testing, making sure we have sound. Again, thank you all for viewing on Facebook Live on your devices for this timely panel. If you have comments or questions, please provide them in the chat, and we will do the best we can to either get you answers today or make sure that you continue to stay connected with us so that we can get them answered later. So first, we will begin with allowing our esteemed panelists to share with us more information about their backgrounds and who they are and what they bring to this critical work. We will begin with Mr. Director Rod Jenkins.
I see how this is. Pick on the guy, I see. Again, I'm so grateful to be here, and we certainly are happy to be back at St. Joseph's. I was fortunate to participate in the first panel discussion, so certainly extend thanks to great Reverend Dr. Augustine and the St. Joseph family, and also to you, State Senator Murdoch, for having me. Again, I'm Rod Jenkins, Public Health Director for Durham County. I have been here a little over a year, and one of the popular things I tend to say is that I did not bring COVID-19 with me. But I do bring you greetings on behalf of the 200+ men and women who have been hard at work all this time fighting COVID-19. At the Durham County Department of Public Health, we pride ourselves on doing just about everything under the lens of racial equity and health equity. COVID-19, as we know, has shed a light on lots and lots of disparities, lots of health inequities, and we have done all that we can to spread the word about COVID-19 in order to have our residents to better protect themselves and others. So again, thank you for being here and look forward to participating.
All right, thank you so much, Director Jenkins. Now we will have remarks from Katie Gilbreth, who is Interim Director at Duke Health.
Thank you so much. Well, thank you again. You know, what a beautiful day to be here. We've got sunshine outside and an in-person meeting, and then all of you at home, and so such a beautiful day. And I also want to thank Reverend Augustine, the St. Joseph's family, Senator Murdoch, for inviting me and including me today. So I am the president of Duke Regional Hospital and also interim head of community health for the health system. And I've been with Duke for 24 years now, the last 20 of those at Duke Regional Hospital. And so I also bring greetings on behalf of the entire Duke Health family and who have been working tirelessly over the last year. You know, it has been almost a year since the first COVID case was diagnosed in our area. My teenage daughter has asked me to ban from our vocabulary the use of the word unprecedented, but that's truly what this last year has been, if we think about it. You know, everything from getting used to lockdowns, to toilet paper shortages, to services like this on Zoom, to much more serious matters, the civil unrest and the really long overdue awakening to the disparities that have existed in our communities for far, far too long. And the recognition, finally, much more widespread recognition that racism is a public health crisis. So today, hope is on the horizon. It's on the horizon in the form of a tiny glass vial the size of my thumb that contains multiple doses of vaccine. And now our responsibility and our commitment is really to make sure we are getting that vaccine, that dose of hope, into the arms, and especially into the arms of those who have been so disproportionately affected by COVID. So today I am honored to be here, to have been invited, and really look forward to just humbly listening and learning and working together.
Thank you so much, Director Gilbreth, and do have to add, I'm just getting to know her, and she's just been so overwhelmingly responsive that I said we had to bring her in for this conversation, share with her my concerns with equity, and just wanting us to kind of follow the lead of other models we're seeing all over the nation, and she got right back with me, so thank you for that. So last but certainly not least, someone that all of us are familiar with in the Durham community due to her long history of advocacy in this space, was thrilled when I learned that you were going to join NCD-HHS. So Dr. Michelle Laws, please share with us your role, more information about the amazing work you're doing at the Department of Health and Human Services.
Thank you, Senator Murdoch. And I want to, thank you. I want to thank you for your leadership and also just for your friendship over the years and in the spaces that we've collaborated together to address multiple health disparities and inequities. So thank you. And certainly this amazing pastor, Pastor Augustine. I have just been watching you from afar, and I'm a social justice advocate by heart. I believe Jesus was a social justice minister, and so it is just an honor to have you and your leadership through St. Joseph's here in Durham doing the amazing work that you're doing. And I also want to just give honor to God for being here, because as an African American, I know that I could be among, as my grandmother would say, in the number of the 10,896 lives that we have lost to this virus. Disproportionately, we know that it is impacting African American communities, Latinx communities, and communities that we refer to as historically marginalized populations. And so being here in my role at DHHS as one of the leads for our historically marginalized populations work group, it's always a pleasure, because I know that hopefully the information that we share through these kinds of discussions can help people make good decisions, informed decisions that can hopefully prevent them from contracting this virus, and also supporting their family members and communities as we try our best with the hope that's here through the vaccine and other preventive measures, wearing face coverings, covering our nose and mouth, to mitigate the effects that it's having. I used to start my presentations by saying, that the COVID pandemic has shined a light on the fault lines in our systems from the state to local levels. Until a community stakeholder member said, we've always known, and thank God that you all are finally seeing. We've always known. So I want to say that this pandemic has certainly shown policymakers, program administrators, all of us who play a role in our public systems, and particularly our healthcare systems, and particularly, it has shown us what others have seen and known all along. And the others I'm speaking specifically of are the recipients of our services that are hoping that we get this right in terms of the delivery of the vaccine, access to the vaccine, and also continuing to get information and resources to communities that are being impacted the most. So I am honored to be here and looking forward to the discussion along with the esteemed panel you've assembled. Thank you.
All right, thank you so very much. And left something out of my opening. I think Commissioner Namashina Burns will be watching us, and she refers to Director Jenkins as our very own Dr. Fauci. So I'm looking forward to getting to witness this myself. I know folks will get a kick out of that. So very high bar. So she is, but that is her phrase. So I will award you with that as we jump in this morning. So first, all of you are on the front lines of this pandemic, and are working to get the vaccine out to as many people as possible. And as Director Galbraith mentioned, we're about a year into this. So can you provide general updates in regards to vaccine distribution, also testing? As we know, you still have to have a very robust testing program and apparatus now that we've learned more and experienced its challenges since the first vaccine became available. And we'll start with Director Galbraith.
Sure, thank you so much. So we actually passed a milestone this week. We hit 100,000 doses of vaccine across Duke Health. 105,000 actually as of yesterday administered. 66,000 of those are patient doses. So we are making good progress. We could make even better progress if we had more supply of vaccine, and I know we're going to talk about that at some point. But to put in context, so we have, in the last year, just under a year, completed 220,000 tests, COVID tests, across our health system. We've had 3,600 patients hospitalized across our 3 hospitals. 861 of those have required intensive care level care. So they've been critical care patients. And today in our hospitals, fortunately, we're seeing those numbers come down. So right after Christmas was really, right after the holidays was really our peak in terms of hospitalizations. And I know that this community knows that and has seen that. But today we're at 126 cases across our 3 hospitals, patients hospitalized. 55 of those are what we call active cases. Those are patients who currently have COVID and require isolation and hospitalization. The remainder are patients who have had COVID, do not require isolation, but still require hospitalization, and many of them still very sick. But those numbers are down. So in January, we were well over 200. So we are seeing the numbers begin to move in the right direction, but not as quickly as we would like to see. We want them to be zero. And so that's certainly why we're trying to do everything we can to get people vaccinated as quickly as we can.
I tend to come with a lot of statistics, so I just ask the viewing audience to bear with me. But I would say after a sluggish start at the Department of Public Health, we're certainly vaccinating efficiently and safely. Durham is definitely outpacing the state in terms of vaccine utilization. And some of the statistics, particularly around communities of color, I would say first doses administered 44,465 as of today. Second doses administered 25,122. So we're certainly well on our way. How do we compare with the state, Senator Murdoch? First doses for Latinx, 2.43%. Durham County, 3.78%. So we know we have a lot of work to do, but again, given the current groups that we're in, that's still commendable. The Black community, as far as state of North Carolina, 14.86%, Durham County, 24.05%. The only real demographic where we're lacking in first doses is the white community, 77.86% for the state of North Carolina, 65.33% for Durham County. When it comes to second doses, those people who have waited a few weeks, Latinx for the state, 2.3%, Durham County, 4.12%, Black community, 10.92%, Durham County, 16.69%, and again, still lagging behind with the white community. For the state, second doses, 82.04%, for the state, 71.7% for Durham County. So again, while I'm not pounding my chest and jumping up and down, I know there's still a whole lot more work to do, and we are committed to doing it. At the Department of Public Health, we have administered approximately 9,500 doses of vaccine. The thing to keep in mind is we started a week late, and of course, we were dealing with Moderna because the handling requirements are a lot less stringent, but we are fortunate to have both vaccines at the Department of Public Health. We've also collaborated with a number of community partners who are vaccinating, and we have actually transferred 9,000 doses to date. And it's important for us to be able to have an extension, to extend our bandwidth when it comes to vaccine distribution, because we certainly can't do it all ourselves. We've had some difficulties with scheduling, but we've smoothed that out. And of course, Duke and the Department of Public Health has an extensive wait list that we're definitely working on a weekly basis. Of course, there's also been some telephone issues because, it's important to acknowledge, but local health departments, particularly counties, are not equipped to have thousands upon thousands of calls. So suffice to say, Durham County has stood tall, being this technology bastion of greatness that we are. We've worked that out as well. And then, of course, I think the last thing I would say is that, second to the last thing I'd say is that we have become accustomed to the state's COVID vaccine management system. It's not been the easiest system to traverse at times, but we've done the best that we could, and I think we're at a very good place with it right now. Definitely salute the state, because there's been a lot of work around it, and they're constantly making upgrades and doing things that they need to do. As Katie mentioned, from a statistical perspective, we are certainly on the downswing, and it's important for the listening audience to remember that the vaccine is also a public health mitigation strategy. It's not the end-all be-all. You still have to practice the 3 W's. You still have to avoid large gatherings. And I wouldn't be a health director if I didn't say those things. But, again, we still don't want people to feel as if they can put their guard down and not do those things. Our 7-day moving average was 73 for last week. So as Katie said, it's going down. 2 weeks ago, just 2 weeks ago, it was 137 positive cases per week. So we're grateful for that, but we certainly know that we still have a long way to go. And I think the last thing I'll say is that while we're on the downswing, we're still very, very high. We're just getting to where we peaked before Thanksgiving. So I have no doubt that what goes up must come down. And I think that we're positioned to really do a lot of great things, particularly once more vaccine hits the market.
Very well said, and you know, each of us have the data, because data-driven response has been key in Secretary Mandy Cohen's response in leading the state in how we try to mitigate the effects of the COVID pandemic in North Carolina. And so the only thing I will add is that, you know, 1.9 million doses have been administered in North Carolina. And Director Jenkins has given you the disaggregated data by Durham County, and we have that information available to the public on our website. And I encourage people to, no matter where you are in the state, to make sure that you follow the data as well, because it is indeed, for many of us who've been a part of this response to this very challenging and aggressive virus since the beginning. Well, in March. It actually, you know, some started back in January here in North Carolina. Our health department's leads, certainly. It is promising to see the trends. We're seeing vaccines go up in communities where there initially was hesitancy, and where we continue to deal with access issues and what I call, you know, historical inequity, medical traumas and structural inequities. And so it's not exactly where we want it to be in terms of the African American and other historically marginalized populations, but we're seeing it go up, because when the first doses were administered in our state back in December, and we exhausted those doses, less than 10%, or right at 10% of African Americans have been vaccinated, compared to 82% of whites. Today, where we are, we've moved up to 14.86% of African Americans, and 2.4% Hispanic, and then of course 0.74 of our American Indian population, and 2.49 of our Asian Pacific, compared to 77.8% of whites. And so we're seeing the numbers go up in terms of access to the vaccine for some of the populations that were really disturbing. It was disturbing to see after that initial batch went out early. And so I think one lesson that I hope, and one message that I'd like to convey, is that, you know, never underestimate the value of having community level based grassroots conversations and listening to what people are telling you on the ground, because those conversations help to put pressure on us at the state to make sure that we were doing things differently. So what are we doing differently? One is, there is now what's called an equity bump that local health departments and other vaccine distributors get to address the inequities in terms of the access to the vaccine. And so those allocations, we're allocating baseline weekly amounts of vaccine based on county populations to ensure geographic equity, and also to ensure that we are reaching populations that are 65 and older, and also represented among our historically marginalized populations. So 65 plus and Black, 65 plus and Latinx. And this is going to be extremely key, because people often say, well, you know, why didn't you start with the equity formula first? And that's a question, you know, that we can debate later and talk about later in terms of lessons learned. But it's going to be key as we begin to open up. We know next week the teachers come online on February 24th, and then following that in March, the additional essential and frontline workers come online. We believe that we will capture many of our historically marginalized populations in those groups because they make up the largest percentage of those of workers in those categories. And so this is important for us, really looking at how we're missing it, but also going in immediately and applying this equity allocation formula. The other thing I want to say, that time is of the essence. We are no longer seeing the hesitancy issue like we once were. And Reverend Barber has challenged us and said that it probably wasn't, Pastor, as significant of a factor as we all initially said, because it's not like black folk don't trust science. They just don't trust how science has been used in the past against us or to harm. But the point I want to make is that as we're seeing new variants come online, the UK variant in particularly, where there's predictions that it could be highly, more aggressive and egregious in its effects and outcomes, we need to get people vaccinated as quickly as possible. And hopefully people understand this. I'm not, I'm giving you information. You use that information to make your own decision. But what happens with these new variants is when viruses mutate and then they replicate in different forms, if we have populations that were already vulnerable, such as those with multiple chronic health conditions, not vaccinated, getting increased exposure and risk, it invariably increases, and I'm not saying this to scare anybody, death rates. And so when we think about who's disproportionately more likely to die, African Americans, 2.8 times more likely according to CDC study or data that was published last year in 2020. And then you read the results of the study that just came out and that was published about the decrease in life expectancy. And so this is not only a public health kind of response to mitigate spread, but it's also an important response to prevent deaths. And so I think I'll leave it there.
No, very, very well said. And you also alluded to, a number of you, vaccine supply. And I'm sure you all probably off the top of your head know 65 and up alone, but I know in the state of North Carolina, we have over 10 million people. So if we're only getting, 100,000 or so vaccine a week, easy math equation shows you that's a lot of what the challenges are, is we just simply do not have enough supply. So in regards to vaccine supply at the state, county, and Duke Health system level, and remind us how large the Duke Health system is as well. I think people forget that. Is it enough to meet the demand?
Yeah, I'll be happy to start with that, and it's a very simple answer, no. Yes. It's absolutely not enough to meet the demand. I wish it were. The good news is that we're that people want to get vaccinated, and that's a great news story, right? But the reality is we're actually only 2 months into this, right? So we're only about 2 months since that emergency use authorization was granted, and so it does take time to manufacture enough vaccine and we're not alone in this in North Carolina, and we're not alone in it in the United States. It's a global pandemic, so everyone is wanting to tap into those very limited vaccine supplies. So the biggest challenge we have right now is that supply. We could absolutely do multiple times the number of doses that we're getting into arms every week as a health system. And to give some context, so Duke Health System, we're a large system. We're 3 hospitals, very wide primary care network covering, and our primary service area covers multiple counties. But again, when the base allocation is less than 3,000 doses a week, and there are adjustments for that, for equity, et cetera, but that is the base allocation, and that has to stretch pretty far. You can see where the math just doesn't add up. We will get there, and again, I believe, we proved as a state, 4 weeks ago, that we could vaccinate close to 300,000 a week, and I think I firmly believe we could do more than that as a state. We just need the vaccine to be able to do that. So as soon as we have that operationally, we are ready to move. And through the partnerships, again, in this community and multiple communities, we're ready to go as soon as we get more vaccine.
And Director Jenkins, at the county level, definitely share with us kind of how you go through the process of allocating such a limited supply.
I echo a lot of the sentiments that Katie just mentioned. To be direct, Senator Murdoch, the vaccine demand far outstrips the supply. And we recognize that it's a global issue as far as supply chain and being able to produce it. And, for the most part, we know that the state has a Herculean task because they are receiving, close to 150,000 doses a week, and they have to divvy it up to an entire state. And for the most part, we understand and we don't fault them. But again, when Durham Public Health is receiving a little under 1,200 doses a week, and the wait list is extraordinarily high, we know that we just simply cannot get to everyone. So, with that being said, as Katie has mentioned, not only our partnerships, but I've been delighted and encouraged by small pharmacies and, physician practices that have operationalized and are ready to go. I've been even more encouraged by, civic groups and neighborhood associations who have reached out to me directly and say, hey, we want to be a vaccination site. A little disheartening at times because I have to tell them that I simply just don't have the vaccine to help you out. And of course, as Dr. Laws have mentioned, the ministerial alliances, they're chomping at the bit because they really want it. So again, the only thing we can do is just kind of really take note of those requests and just let them know that we'll certainly get back to you when the vaccine becomes a little bit more robust. I tend to be an optimist, and I just know that within the next 4 to 6 weeks, it's going to be a different story. But as Katie's mentioned, we're ready. We have the manpower. We've had a lot of trial and error as far as getting the vaccine out, and I know that we could do huge numbers. We just need the vaccine.
Ditto. I mean, absolutely. It's supply. Now demand is far outpacing and driving supply, outpacing the supply. But I too, like Director Jenkins, I am extremely optimistic and really excited about the response from our communities, from faith leaders to community-based leaders, civic organizations, grassroots folk who live in far eastern part of our state or the far western part of our state, who are saying, what can we do? We want to help, and have raised their hand, have completed that online survey that we've created at the state level for people to essentially raise their hand and say, we want to be a part of the solution in helping to get people vaccinated in our areas. But Director Jenkins is also correct in the reality. We've got 100 counties in North Carolina, and with such limited supply coming into, and it's not just North Carolina, right, but coming into the states at this particular time, there's no way that we can avoid having waiting lists the way that we do. Now, I do think that while we wait, there are things that we can do to allay the concerns and to diminish the anxieties that communities are feeling. So I'm beginning to hear people say, at first it was, is there anything in the vaccine that's going to kill us? And that intentionally has been created to harm historically marginalized populations. Now it's, oh my goodness, are you all going to let us die? White people have gotten vaccinated and we haven't. What's going to happen? And so I want to allay the concerns of people that still our best defense until you get vaccinated and even after is what we're doing right here today. wearing your protective covering over your nose and your mouth, your mask over your nose and your mouth, making sure that you're washing your hands and wiping down and sanitizing surfaces, disinfecting areas that people come in contact with, limiting the number of people that you are exposed to, and when you are out in public, make sure that you are maintaining at least a 6 feet distance. Because until we get enough supply to get people vaccinated, we still need people practicing, and even beyond, like I said, after they get vaccinated, the 3 W's and those preventive measures. We also need people to get tested, to continue to get tested, because the majority of the cases have come through asymptomatic contact with people with no symptoms, right? So asymptomatic. So I encourage people, don't forget the other stuff that we were working on. And make sure that, you're getting tested. And a good reason, or, just because we need to do that and that's good practice, it's a good thing to do. But some people, I've heard, I've talked to folk and they've said, I can't get my husband, or my mama's been sick for a few days. I'm scared to take her to the doctor. Do you think I need to get her tested? And my response is, well, absolutely. If these are the symptoms, you check the symptoms, and they are reflecting or mimicking what you think or looks like what you think is COVID, absolutely. Because the longer you wait to get tested, and if you are positive, and the sicker you become, that also creates an additional burden on our healthcare systems. When we have to take people have to be admitted into the hospital, they have to be intubated, or whatever the results are of their coming in contact. So I'm telling people, let's mitigate, let's make sure we know where people, the risk of exposure, where people are getting exposed, where people are have come in contact with somebody who has been exposed, and you do that by testing, and contact tracing. So let's continue to do the things that we've said while we wait.
I want to ask a follow-up question regarding accessibility and obviously the lack of supply. We have a question in the chat. It does pose 2 specific names, but I wonder, 2 specific brands of the of the vaccine, but I wonder if it's interchangeable. The question is it true that you can safely take a Moderna vaccine and follow up with a Pfizer vaccine? The person who asked posed 2 specific names, but I wonder, can you mix dosages of the vaccine in general?
Dr. Augustine, from what I've been told and all that I've read, you should not. If you have been vaccinated with Pfizer and you've been scheduled for your 2nd dose, you come back and you get Pfizer. I think over the past week, I've heard a number of different questions about this very same topic, to which I've replied the same. You keep your appointment. I think the most important thing I can say, Senator Murdoch and others, is to everyone under the sound of my voice, take your 2nd dose. Mm-hmm. I've also heard some rumblings about people saying, I'm not going to take the 2nd dose. And it's important that you keep that, because that's the way that you become immunized. So until there is a 1-dose situation on the market, 2 doses is the way to go. The other thing I was going to say, Senator Murdoch, I neglected to talk about testing. Yes. And I'm a proud health director right now, because at 414 East Main Street, we got the trifecta going on. We have testing in the parking lot, we have surveillance work on the 3rd floor, and we have COVID vaccination on the 2nd floor. It just doesn't get any better than that. So.
Thank you so much, Director Jenkins, and as a follow-up, because we are also here to dispel myths, to carry over from the first workshop, was actually listening to some reporting on CNN last night, and we know this 2-dose question is going to continue to come up, because they're now reporting, I believe out of Israel, that if you do take the first dose of Pfizer, it may have a 70-some-odd% of being effective. So I guess maybe I would like for you to reiterate that we still want folks to take 2 doses, because I know we have to report all the research, but I was concerned about that.
Again, I just that report came out, and that just kind of, I guess, somewhat put a light bulb in people's heads. But again, both vaccines are 95% effective. As Katie mentioned, there's, talk about the first dose being, of Pfizer being 70%. Then, of course, we have a new entrant into the market with Johnson & Johnson not being as efficacious as the others. But as Katie mentioned, about 2 months ago, we'd have been beaten down the door for 65%. So with that being said, we still need for everyone to really, really do all that you can to take your second dose. We want you to be 94.5 or 95.4% vaccinated because, again, there's still that 5%. So, again, we want you to be vaccinated, we want you to be protected, and then we want you to continue to practice those public health mitigation strategies that's going to keep you safe.
I have a quick follow-up question with regard to mitigation. Dr. Laws, I certainly appreciate you emphasizing the continued importance of wearing masks, obviously washing hands, maintaining social distance and the like. I saw a report, possibly on CNN, also Senator Murdoch, but I saw a report that we may be asked to wear 2 masks now, coming up in the near future, 2 masks. My question is there a preference on what type of mask is better? What type of mask is more effective? Cloth mask, a surgical mask, the KN95 mask? Which would be more palatable? Which would be better, you think? Which would you recommend? And the question is for all of you.
Happy to jump in, and I can be followed up by my esteemed panelists. But a report just came out that said that if you wear a second mask, you're even 40% more protected. So again, that report just came out from the CDC early this week, and it really provided that clarification. They did say that you can wear a surgical mask if you have, and they encourage a cloth face mask over it. So again, with all these different variants, to be quite honest, there's probably about 7 or 8 different ones. South African, there's the UK, there's the one from Brazil. Locally, there's the California variant due to the outbreak that they had in California. So there's a number of different variants. So the main thing you want to do, again, it's a personal choice. But we want you to mask up. We want you to, that CDC report talked about the 2 masks, but they also talked about making sure that you wear it over the bridge of your nose, make sure it's over your mouth, and make sure it's on the cheek, and make sure it's very snug. So again, that second mask will help reinforce it. It also talked about possibly wearing it around your neck, and then if you put it around your earlobes, just make sure that it's tight. So again, it's all about making sure that you have a nice seal to protect it from the variants.
Exactly, and I'm so glad that you mentioned that study. And so that's what I began to do, right? So I wear a surgical mask and then a cloth mask because I have these in abundance. I think everybody was at home making them or either, getting them. They're easy to get and to distribute. And this is our Hope for NC helpline mask, by the way, that provides a line for people to call who are having mental health and substance use disorders concerns during this pandemic. So we cannot forget about the behavioral health implications and consequences of this pandemic as well. And I'm hoping at some point we'll have a panel on mental health and behavioral health and what we're seeing. But it is extremely important. I say, if you don't have 2, please still wear the one that you have and make sure that you're wearing it appropriately or correctly. And there's guidance on our website at DHHS at the state, www.dhhs.nc.gov. You can go there and you'll find a little video on how to appropriately wear your mask. And again, increased 40% effectiveness is something I think we all should try. Anything that increases or decreases our risk is something we should try. But I'm so glad you brought that up. That is such an important new finding.
And I'm just trying to be that frog that praises his own pond. I got Durham Public Health on mine. But I will say, as Dr. Law said, ncdhhs.gov, and of course, decodpublichealth.org will give you a bevy of information about all things COVID-19, all things public health.
Yes, thank you so much, because as we all know, we still have to follow the 3 Ws, and that will still assist us as we move forward. It's not just about getting vaccinated, but it's about engaging in behavior that we know will help with reducing the spread and transmission of the virus. So we have a lot of exciting community partnerships. I think I get emails about them every week where it's hard to keep up, but that's a great problem to have. And so I think we'll start again with Director Jenkins, then Katie, then Dr. Laws. And I think first let's start with, as we all know, we want to get our teachers vaccinated as soon as we possibly can. Knew behind the scenes that a lot of conversations were occurring, but it is public now that the county and Duke Health will be working to get about 1,000 teachers vaccinated a week. I believe for Durham Public Schools, we have around 5,500 if you include all personnel. So was elated to hear that news, since we do want to safely open our schools at some point. So I think that partnership, and also we're at a church today, so if you could let us know about some other community partnerships that you've recently announced and have on the horizon.
Indeed, this great woman sitting next to me is a trusted partner. We have been really connected at the hip through the entire pandemic, to include participation in the Recovery and Renewal Task Force established. But again, our partnership with Duke's Division of Community Health has been invaluable. It's allowed us to stand up the Holton Recreation Site for testing. It's allowed us to establish the Southern High School site for COVID vaccination. So we are definitely great partners, and we will continue to partner. We also, as I aforementioned previously, we're delighted to know that there's certain pharmacies that have come online that are willing to provide vaccination to our educators as well. We do also want to lift up our partnership with Walgreens. Walgreens has 11 sites throughout Durham, and they're able to provide, at present, 100 vaccinations per week. And I can see that increasing probably as the vaccine allocations are able to increase as well. So again, there's also been talk of a state-sponsored mega site, and of course that's been paused due to vaccine allocation as well. But again, if that should come online, the planning has been done, and I'm pretty sure that that could be stood up and operationalized really soon. Durham Public Health is also working with the state. Grateful for our partnership with the state as well for an additional vaccine site. That should come and be stood up within the next few weeks. And that is not a state sponsor, that is actually a state collaboration with a vaccine provider. So as you've mentioned before, Senator Murdoch, I mean, it's not going to happen overnight. And it's also important for me, and I think Katie will appreciate me saying this, the 1,000 is a goal. It's not a definite, because everything depends on the vaccine. But we're overly committed to making sure that our educators get vaccinated. And to the listening audience, I know Senator Murdoch said 5,000, but the number is actually 8,000 or 9,000, because we have to also include charter schools, private schools, and daycare providers. So that's a pretty tall order.
Yeah, so I'll add on to that, and thank you so much for mentioning that. It absolutely is our goal to be able to get our teachers vaccinated. We know how they really are heroes on the front line. Our teachers, custodial staff, cafeteria workers, daycare providers, and so we want to get them vaccinated. We do have to balance, and with the limited supply, it is a tight balancing act, because we have so many people age 65 plus who still need to be vaccinated. And the reality, the stark reality, is that those age 65 plus are at greater risk for major complications or death from COVID. And so we do need to balance that. I will say, I'm so thrilled with the partnership that we've had the partnership we have with the state, with the health department, and with a lot of community organizations. So I just came over here today from our Southern High School site. So Southern High School is typically open Monday through Friday, and we have evening hours at Southern because we really wanted Southern to be available for those who either are working themselves or the person who may provide transportation for them is working during the day. But this week we are open on Saturday. Again, we partnered with Durham Public Schools and it's the health department and Duke Health partnership on that, and have partnered with a number of community organizations, the Community Health Coalition, the African American COVID Task Force, and they have been actually making those appointments for today. So we should vaccinate over 500 today. And that's really partnering, and the African American COVID Task Force is working with churches and with other community organizations to be able to fill those appointment slots. I think that's a great example of the type of partnership that we want to be able to do more of as the supply increases. The other thing that we've done is we've had two what I would call pilot vaccination pop-up clinics, if you will. And a pop-up clinic is what it sounds like. It's not one of our standing sites, but we went last week on Tuesday night to the Latino Credit Union, partnered with the Latin 19 group, and again, they made all of those appointments, scheduled them. We were able to get 150 people vaccinated. It was an amazing evening. It was, first of all, the credit union was so gracious to host us and host the community there. But they even had a DJ, so there was wonderful music playing, and it really felt, the idea was to make it feel comfortable and a comfortable environment. And then on Thursday evening, we had one at Nehemiah Christian Center as well, and we have one next week at Union Baptist Church. So we are starting to work on those, but we are limited, of course, right now, but I expect we'll be able to do far more of those partnerships in the coming weeks. The other things that we're doing really to reach out, so within Duke Health, we are reaching out proactively to anyone African American or Hispanic 65 plus who has been a patient anywhere within Duke in the last 2 years, and reaching out to get them on our waiting list. And then for those on our waiting list, we're really working to reach out to them to answer questions, listen to any concerns, and expedite getting those appointments.
And Dr. Laws?
I want to say that in addition to the amazing partnerships that we have with the local health department and with our medical centers like Duke, including Duke, and in fact, Dr. Viviana Martinez Bianchi, who spearheaded or was helped with the Latinx vaccination event at the Latino Credit Union, is on our work group, plays a critical role. She's also, plays a dual role working with both Duke and the state as a contractor. And then also Director Jenkins has graciously allowed one of his team members also to play a critical role at the table with us through the historically marginalized populations work group, Dr. Jackson. So obviously our vaccine distributors as partners are critical to us and at the state level, but also we utilize community health workers. So 386 community health workers have been deployed in over 55 counties. We've got 225 trained to support vaccination, education and registration. And then we also are getting ready to make another huge investment in standing up even more community health workers who can go into the communities, who represent the communities, and get people registered, identify who has not received a vaccination and the like. And the same with our testing efforts. They have played a critical role. Utilizing peer support specialists to help people who are sitting with, who have a diagnosis of mental health. A study that came out recently found that people with a mental health diagnosis were hospitalized at a rate of 27% higher than those with no mental health condition. And so with COVID. And so those with COVID without a mental health condition compared to those with COVID with a mental health condition. So again, I want to underscore the importance of that. work, and then working with our HBCUs. Working with historically black colleges and universities and also the UNC Pembroke, which is historically minority serving. And so those kinds of partnerships have proven invaluable. And again, I've mentioned over and over again, I cannot say enough about the extraordinary partnerships and the impact of those partnerships when we've partnered with faith-based organizations. And so the Secretary has a monthly call with faith leaders from around the state as well as community-based organizations to hear directly from them.
I want to take a moment, if you don't mind, to ask a question about communications. We received a very specific question, and I want to pose that, but I'd like to use it as sort of a segue to talk more broadly about how effective we are in communicating with one another through contact tracing and the like. The question is, are North Carolina citizens effectively using the Slow COVID NC app? I don't know if you have any empirical data or statistical data about the use of the app, but in addition to that, if the three of you could talk more broadly about how contact tracing is going, about how we're communicating with one another, about how you all are getting information out, especially to communities that may not have internet access and so forth, so on.
I'll start off, and maybe Dr. Laws and I could double team this one. I know Durham Public Health still promotes the Slow COVID NC app. I know we have various links to it on our website. I definitely want to speak to contact investigation and contact tracing. Whereas other local health departments have veered away from that in their efforts to ramp up COVID vaccinations, Durham Public Health, if anything, we've doubled down on that. We have a group of in excess of 105 people who really make up our total surveillance unit, to include contact tracers who are able to work from home, to include contact investigators who are actually on site. It was important for me to really emphasize that I did not want surveillance to dissipate. I wanted it to continue to go strong, and I think that is really what's garnered Durham's success. If you could think back to when the COVID pandemic began, it was Wake, Mecklenburg, and Durham. Now it's Wake, Mecklenburg, Gaston, Cumberland, Forsyth, Guilford, and then Durham. So that really speaks to our surveillance efforts, our contact tracing, to really get at the question of Dr. Augustine. We still make calls, even though there are technologies available to allow technology to contact individuals. We still are doing a lot with clusters. We're still doing a lot with long-term care facilities. We still have strike teams that are going out to facilities when there's an outbreak. Nothing has changed as far as we're concerned, even though we have been encouraged to temper it down a little bit. The only way that we're going to reduce community spread and infection is to continue to do what we're doing. Dr. Lawson?
I think you answered both perfectly. We do obviously encourage still the use of the Slow COVID NC app. A lot of investment and time to, I think, refine that app and look and make sure that it, and study it to make sure that it was appropriately tracking and giving us the information that we needed to know in terms of the spread. And where people ask me all the time, they say, you told me to download that app, and I've never gotten a ping. I've never gotten and I said, well, that's a good thing. That means you haven't come in contact with people that are in the system. And so it only works as good as we use it and as people, as information gets in. So I went on our website to see if we had any updated stats on the use, but I do encourage people to still use it. Any mitigating attempts that we are using at this time, I think, is important. And then on the contact tracing, our case investigations, we call them. It's important and I understand why people are hesitant to share information, but it's important for us to know who has been exposed and who has the potential of being exposed so that we can get a handle on spread. And so that's the only thing I would add to what Director Jenkins has said. It's not to get in your business. It's not to surveil you by the state. It really is to figure out where we're seeing this virus spread. And if you go on our website, you can look at the map of the spread in North Carolina. At one point, it was all red except Greene County. And now we're seeing slowly and slowly red, orange, and yellow. So information is powerful. It helps us to zero in, target in. The surveillance data helps us better to just know how this virus is traveling through our state.
The only other thing I'll add is that, again, our data hub on our website provides a wealth of information. And every week we publish what we call a weekly reflection. And that weekly reflection really gives, sort of in a layman's term type setting, how we're doing as a county in terms of 7-week average, daily week average, as far as whether or not, the curve is bending, so to speak. It gives the latest and greatest trends. Then, of course, you got this guy here with the microphone that does weekly updates, much to my chagrin at times. But I think since the pandemic began, y'all, I've probably done maybe 35 of those things. But I do it with a smile because my PIO, Dr. Alicia Smith, wants me to do them. But I also do it because it provides good information that our residents need to know to keep themselves safe. And I think the thing that really tickled me this morning was that I did start off my day in the vaccination clinic with my staff, and then I had a resident to come up to me and say, "Thank you for doing those videos. I find them to be very informative." So I think it's working.
Yeah, thank you so much. And I know Lincoln Health was a part of the first conversation, but do talk with their staff as well. And they're doing something similar in regards to calling all their patients, as we know that they serve a lot of marginalized and minority communities. So even though they aren't a part of this panel, did want to highlight that they are aggressively contacting all of their patients as well as soon as they have enough vaccine to come online to get their appointments filled.
May I say the FQHCs have been extraordinary partners also, and important in the work that we're doing as well at the state.
Yeah, Lincoln is such a jewel in Durham. I mean, we're so fortunate to have Lincoln and all of the FQHCs across the state, but Lincoln is particularly special and has done a great job with that. I would say we also are committed to reaching out in the way that makes the most sense for our patients. So if we reach out by email and we're not getting a response, then we're getting on the phone and we're calling. We're looking at patients who have access to communication through MyChart, through the electronic health record. Those who don't, we're doing phone calls so that we can reach out to them, because we recognize that not everyone gets and receives information in the same way.
And as we continue to scan for additional community questions on Facebook, did want to just kind of stress again to folks that are watching how they still can get their spot. I believe Duke Health, the wait list is over 50,000. As a Duke Health patient myself, I think that's about where that number is, but still just let folks know how they can get in line.
Absolutely, yeah. So our waiting list is very long. What I will tell you, though, about that is, again, if we had the vaccine available, which we don't right now, but we will. I'm a glass half full person as well. I'm an optimist, and we will get it. We could work through that wait list in 2 weeks. So less than 2 weeks, probably. I mean, that's the operational capacity that we have. We can easily do 25 to 30,000 vaccines a week within Duke. So please get on the waiting list. Don't hesitate to get on the waiting list. I understand it, we've had challenges with the phone lines because of the demand. And so I know that's been frustrating for people. There are a couple of ways to get on the waiting list. Certainly you can go to dukehealth.org and you can sign up for the waiting list actually online from that website. If you don't have easy computer access or prefer not to do it that way, you can also call our number, and that's 919-385-0492. Those numbers are 7 days a week, 8 a.m. to 8 p.m. Again, we have experienced peak call volume that has made for much longer than we would like waits. Right now, we're down to less than a minute wait for those phone calls, so people should be able to get through and be added to our waiting list. So really, really would encourage people to do that.
Let me ask a question regarding the time delays between treatments. Obviously, there is a 21-day time delay between the first and the second dosages of the COVID-19 vaccine. A question from the chat, however, asks, if you have to take a shingles vaccine or even a mammogram, what length of time should there be between those activities? Let me broaden that question to also ask about flu shots or any other vaccines that individuals may take. What sort of timeline would you recommend between COVID treatment, COVID-19 treatment, and other vaccinations?
Thank you for that question. By and large, if you've taken like the shingles vaccine or the flu vaccine, on average, they're asking you to wait at least 30 days before you consider taking the COVID vaccine. The only very lengthy time frame between, I guess, in consideration of getting the vaccine is if you had COVID-19 and you had to be treated with monoclonal antibodies. If you have had like a severe case of COVID and you had to get treated with that antibody, they're asking you to contact your provider and also wait 90 days before you get the COVID vaccine. That is really the only time frames that I know of at present. To go back to your question, I will say during public health, we have paused scheduling because, of course, we don't have as much vaccine. So again, we have been not really sitting on our hands. We've been very strategic in working our wait list. About a week and a half ago, it was at 11,000. We have used technology to contact those folks and just to determine whether or not they still want to wait or whether or not they have already gotten the vaccine. I'm proud to report that that has been whittled down to right at about 3,000. So the technology is certainly working. We definitely encourage folks to, go to decodepublichealth.org/COVID-19 vaccines. Again, that's decodepublichealth.org/COVID-19 vaccines. That is our dedicated site for not only all things COVID-19 vaccines, but also for scheduling appointments and getting on a wait list. I also encourage our listening audience, if you are a customer of Walgreens, go to walgreens.com. If they haven't reached out to you already, there is an opportunity for you to possibly get an appointment with them. They are operating by appointment only, but again, that's just another avenue for you to approach. And again, we're optimists. We know that more vaccine is on the way. We know that there's going to be more opportunities for people to get the vaccine, but this is a vaccine without borders. People are going everywhere. People are signing up on lots of different places. So you would be amazed by the number of people that we get from other counties and locations and everything. So I mean, that's another good challenge that we have.
Yeah, and it's I was gonna say I went back and forth if we wanted to kind of talk about that today, because I think because we do have another great audience question, but I do think we should touch on folks that are going to other counties. I hear it all the time. Right here in Durham, they're going to Alamance County, Granville County, in Guilford County. My mother had challenges. She's been living in Guilford County the majority of her life. Previously worked with the Guilford County Health Department and was finally able to get an appointment at Mount Zion Baptist Church. They're partnering with the churches, and since she used to work for the health department, they said, "Ms. Murdoch, why didn't you just call us? Like, I'm sure we could have figured something out. You worked for us for 30 years." But at any rate, do you all want to touch on kind of how that's occurring? I think most recently, even in Harnett County, I've heard that folks are going there with very little wait.
Yeah, so the state has set up a way for people to find where you can go and get vaccinated or where vaccination events are occurring. So on our website, that's what I wanted to share. Also, the other resource, Find Your Spot, Your Shot, Your Spot. But on our website, covid19.ncdhs.gov/vaccines, you can find your group, whether or not you are in the eligibility group that's currently being vaccinated. You can also find the vaccine location. And as Director Jenkins mentioned, it's a virus without borders, but it's also a free vaccine that's funded by the federal government. And so people can access it anywhere they can access it. And that created, I think, some of the disparities in the onset, because think about this. If you live in an area, say and this is using a case example, if you live in an area, say in the far western part of the state, but you don't have reliable transportation, your old clunker just gets you around town, and you find out, say you're in Asheville in Buncombe County, and you find out that there's this huge mass vac site at the Charlotte Motor Speedway, this is a true case, but you can't get there. People with resources, a good car, money to spend the night in Charlotte or wherever before heading back or getting into town early. So some of the inequities that we realized and that drove people from county to county, shined a light on what we needed to do in terms of making sure that there was specific instructions given and guidance given for people to serve those locally and prioritize their distribution in that manner. Not saying you can't come, but my priority are those that are Durham County residents or and that kind of instruction has proven valuable in shifting the disparities that we started out with, or the inequities that we started out with. But that's how that happens. You can go anywhere.
She definitely triggered a good point that I wanted to add. I'm pretty sure Katie would appreciate as well. Go Triangle and Go Durham does provide free transportation to your vaccination appointments. While I apologize for not knowing the number off the top of my head, I'm pretty sure if you Google, if you're able to put it in the chat, that'd be great. If you have an appointment and you have transportation needs or whatever, there is a ride for you to be able to get to your vaccine appointment. She also triggered something I wanted to say to the listening audience as well, is that I am so grateful for my data team. They have established and stood up our data vaccine dashboard. And again, I think I mentioned it earlier, but it does have all of this information out there as far as demographics, but it's a lot of great information. There's also a section that has a vaccine locator specifically for Durham. And we are constantly updating that just to make sure that we continue to be as open, honest, and transparent with the information as far as COVID-19, which is what we've been doing since the beginning of the pandemic.
And I want to say, and I'm so glad that you mentioned the Go Durham, Go
Durham, go Triangle. Go Raleigh too, I think.
Yeah,
all
right.
of them.
Public transportation. Because there was $2 million invested in from the state level to provide stipends or help people who are having challenges where transportation is a barrier to getting to a vaccine site. And I know St. Joseph's folk aren't just Durham folk, so I know that you have members that are spread throughout the Triangle and beyond. So I wanted to say that it is a resource here in Durham, but it's also a resource that's available across the state for public transit authorities that are participating. And I think many of them are utilizing their departments of social services to dispense those dollars or the vouchers.
Thank you. And we have another great question from a viewer that I'm going to lift up that we receive a lot. How often will you have to get the vaccine? So obviously with the flu shot, you typically want to get it annually. As more vaccines come online, do you all foresee that we will need to get these COVID-19 vaccines every year?
To be determined. I think that's the best way to answer that. We certainly hope not. However, you know, we certainly recognize that this vaccine is nothing short than a miracle. We get this flu shot annually, and it's a 50-50 type situation. I think straight out the gate, this vaccine was 95% effective. So we're certainly hoping that that's not the case, but you know, more to come on that.
Yeah, I agree. We just don't know yet, but I do think it's an important point to remind people and reiterate once again the importance of getting that second dose, because it only gets to 95% effectiveness after that second dose. So.
Okay, I think since we're a little over an hour, Pastor, if you have another question for we.
Are there any specific things, let me pose this to Dr. Laws from the state perspective. Are there any specific things, I know Governor Cooper has been out front as an advocate for social justice, recognizing certainly the inequities that have historically existed, recognizing the inequities that currently exist. Are there any specific things that the state is doing to promote vaccine distribution in minority communities? Is there any advice you can give our viewers? We obviously are waiting for a more robust distribution, but any advice you can give minority viewers in particular?
And so, thank you, Pastor. One of the things that we are doing through our historically marginalized populations work group is looking at investing and investing resources, money. At some point, we will be making an announcement, but investing in minority communities to help facilitate them serving as partners in this. In the work that we're doing to get people vaccinated. The problem is still supply. And so the other things that we are doing is having a way for people to come online, again, raise their hand and say, we want to partner with whomever we're matched with, whether it's Duke, whether it's the Durham Health Department, wherever, we want to serve as a vaccination site. In terms of the long-term and structural inequities of our system, we've been looking at that along the way too, because the last thing we want to do is to end up here again where we were, behind the 8 ball, as they would say, when this pandemic hit our state. And there were some things that we should have known, like the community stakeholder or member said to me, y'all are just seeing it. We've known all along how accessing. So taking a look at that and investing dollars, looking at what that needs to look like in terms of an investment to address some of the structural inequities. So those are some, and then I've been asked the question in terms of the social justice piece too about prisoners and the incarcerated, and DPS has their own strategies and teams that are working, but we also have members of our team that is working with DPS as well to make sure that we're reducing harm and mitigating the effects of people who are incarcerated, understanding that many of those are Black and brown folk in North Carolina's prison.
Thank you so much for reminding us of that. I was recently appointed to the Select Committee on Prison Safety, and we actually have an expert in that field that's in District 20. She did some work with Senator Warren, so we are looking to file legislation around data transparency in the prisons, because that's been an issue as well. As you know, you can't tackle an issue if you don't have the numbers to show you what the root causes are and what the true problem is. So as we have our closing remarks, just kind of think of other things that you want to mention that weren't covered during our discussion. So first, we'll start with Director Gilbreth.
Sure, thank you. Well, I just want to thank you again and thank Reverend Augustine and the St. Joseph's family for inviting us here today and having this really great discussion and conversation. I continue to learn so much every day with this. We are absolutely committed to making sure that we are getting vaccine distributed, starting with our historically marginalized population. So we are committed to doing that. We're excited for the day when we will get more supply, and so can really, really do that in a much more robust way than we can today. But really, really excited to be able to do that. So thank you again, and look forward to continuing to partner and continuing to work together with the community.
I'll just say again, thank you to Senator Murdoch for the invitation, and to the Reverend Dr. Augustine. I think my grandma would get me if I didn't say, it is good to be in the house of the Lord. Amen. It just feels good to be in church. So again, I thank you so much for the invitation. Durham Public Health is here. We're going to continue to do what public health does, which is to educate, to mobilize, to operationalize our strategies. We are fiercely committed to the work that we've always done with historically marginalized populations and bringing that awareness. We too look forward to the day when our vaccine supplies are more robust and we can able to really work with our community partners to get this out there. But you know, as I've said so many times before, this is, you know, what seems to be the final hurdle to get us to turn that corner and get back to a certain sense of normalcy. And I think I'll just end like I normally end with my weekly videos, which is, we can do this, Durham. We can do it. That's all I have.
Well, I want to say, again, thanks to God that we're all here and able to do this. It's been an honor, and I'm always honored to serve in any capacity. I want to thank you, Senator Murdoch, for extending the invitation to serve on this panel with these esteemed panelists that I respect and admire their work from afar, looking at the state and listening to them on calls and sharing calls with them. But they're doing stellar work here in Durham, and as a Durham County resident, Chapel Hill address, but Durham County resident, I am so proud of what we're doing here. And then to you, Pastor, thank you. You counted it not robbery to allow us this space, and your leadership and wisdom, you know, clearly you understand the importance of this and sharing information, and so I just bid you Godspeed and God's blessings as you continue to lead us in this community. You're definitely a breath of fresh air and welcome force. It is Black History Month, and so Carter G. Woodson, our great historian and educator, said that the mere imparting of information is not education. And I want, most of all, for our people in our communities that have been historically marginalized and that have experienced historical medical traumas to understand that it's important, not that you just get information, because many people are getting information from untrusted source, they're getting disinformation, they're listening to people on, you know, social media and so forth. I always impress upon our folk to make sure that you are getting educated with factual information, that you are getting information from trusted source, and to trust the science. Trust the science, including people of faith. Albert Einstein is quoted as saying, "Science without religion is lame, religion without science is blind. God remains a mystery to me," he says, "but a comprehensible mystery. I have nothing but awe when I observe the laws of nature." Trust factual information coming from our very own Dr. Fauci, as I think you've been trust the science. It is so important that our people do not perish for lack of valid, lack of trustworthy information. And I'm always willing to do that at the state level in any capacity that I can. I agree, we can do this and we will get through this together.
Thank you. And the pastor of this great body will close us out. But again, thank you all for sharing some of your Saturday with us. We will be posting this on the Facebook page right here at St. Joseph's. It's on my state Senate page as well as my personal Facebook page. And also just as a reminder for all of us to use our platforms to provide accurate information. We do know that this is a pandemic that's having a disproportionate impact on Black and brown communities. So we all have a duty and obligation to use the platforms that we have to make sure that folks are getting educated, getting the most up-to-date and accurate information. And it's a moving target. Information changes all the time. I think that's also, I will say, we're still in unprecedented times. What you share one week, it may change the very next week, particularly when it comes to vaccine supply. That's why, as you mentioned, Director Jenkins, even when it comes to vaccinating our teachers, that is a goal. It will still depend on vaccine supply. So just we'll continue to have these conversations so that the lines of communication is open, and just want to thank the St. Joseph family again for always serving as a leader in this great community. We look forward to sharing more. We are working with Dr. Laws and the Department of Health and Human Services so that St. Joseph's can be a vaccination site right here in Durham. Have also been in contact with World Overcomers that I was a member of many moons ago, but huge church with a lot of capacity, has the ability to do parking rides, Mount Vernon, Abundant Hope. Councilman Mark Anthony Middleton has offered his church as well. So many community partners that are stepping up, and we look forward to being able to work with everyone as more supplies come on board. And just know that we all are in this together, and we are so close to reaching a turning point, and we have to continue to stay focused on moving forward each and every day.
All right, thank you so much. And as we prepare to close, I want to say thank you to my friend, and I'm so proud to say my senator, Natalie Murdoch, for your tireless leadership, for all you do in advocating on behalf of our community and our county. Thank you so much. To those who participated in the panel this morning, the three of you, my goodness gracious, thank you for addressing mistruths. Thank you for providing accurate information. Thank you for giving of yourself so freely to help people and to share information. To those who are watching, especially those who are not members of the St. Joseph family, our church believes that we are supposed to be one-stop shopping. We are supposed to be a place, of course, where we provide spiritual sustenance, but we are also a place that serves the community. So we are delighted to partner with you all this morning in serving others, and I want to say thank you, and you're always welcome at St. Joseph Church. Thank you all so much.